time and this.
Yeah, I'm gonna let you go first because it's
Okay.
now 7:11. So
Okay.
I'm gonna have you do a presentation and talk about the services at DSS. So the floor is yours.
Okay, thank you. Thank you so much, Community Board Aid, to having the Department of Social Services HRA to be part of this webinar tonight. My name is Maritza Cortázar. I'm the Community Engagement Liaison from Social Services from the Office of Community Outreach. I'm going to be switching to the presentation. Just bear me 1 minute. So hopefully you guys can see presentation. Yeah.
Yes.
Perfect. Okay, I want to make sure. Okay, so perfect. So, okay, so New York City Human Resources Administration, the Department of Social Services, HRA, is dedicated to fighting poverty and income inequality by providing New Yorkers in need with essential benefits. HRA connects over 3 million New Yorkers to a variety of benefits and services designed to meet their social service and economic needs. HRA is committed to serving all New Yorkers regardless of their case, religion, race, religion, sexual orientation, gender identity, language proficiency, and disability status. So the core benefits and programs. We offer cash assistance, employment services, SNAP benefits, medical insurance, child support services, homelessness prevention services, home energy assistance program, fair fares. Assistance for the most vulnerable New Yorkers. We also offer IDNYC, HIV/AIDS Services Administration, home care services, adult protective services, domestic violence services, community food connection, and burial assistance. So all the details that you see here, we're going to go on this presentation. So I'll not be reading each of the slides, but I'm going to give you an overview, especially we have a short time, okay? So most importantly, everyone is allowed to apply for any benefit or service regardless of citizenship or immigration status. Eligibility for some HRA benefits and services may depend on a citizenship or immigration status, while others are available regardless of citizenship or immigration status. Undocumented parents can apply for benefits for citizens or non-citizen children who may be eligible. HRA will not report personal information to anyone, except if required by law. HRA staff will only ask about immigration status if it is required to determine eligibility or if it is required by law. The DSS Office of Civil Justice provides immigration and employment legal assistance through experienced nonprofit legal organizations to help low-income immigrants navigate the immigration system, protect their rights as workers, and address issues as survivors of human trafficking and domestic violence. Also, our Department of the HRA provides free languages services at all locations. Telephonic, bilingual staff, interpreters can be accompanied by staff who visit. Written materials are translated in Arabic, Bengali, and simplified traditional Chinese. So if there is a client who needs assistance because they have a language barrier, we have the service available, okay? Reasonable accommodation. Reasonable accommodations are available for individuals with disability who need assistance accessing HRA programs and services. Some examples of reasonable accommodations are flexible schedule to avoid rush hour travel, assistance reading and completing forms and notices, priority appointments to minimize wait time at HRA offices, sign language interpreters, and home visits. How do you request a reasonable accommodation with HRA? You can ask for reasonable accommodation at any HRA location or program. You can ask for accommodations by calling the Office of Constituent Services, 718-557-1399. You can complete and submit HRA reasonable accommodation, RAR form. Forms and written requests can be returned in person at any HRA office or via email or mail or fax. If you decide to mail this reasonable accommodation at this location, Human Resources Administration Office of Constituent Services only can be mailed. This is not a place that could be dropped off, okay? So the 150 Greenwich, 35th floor in New York, 10007, okay? Fax number is 212-331-4685 or 212-331-4686. Okay. New Yorkers who are deaf or hard of hearing and use American Sign Language to communicate can now reach the New York City Resources Administration, HRA, through our ASL direct video phone number based at InfoLine. Video phone number is 347-474-4231. Video phone calls are available Monday to Friday from 8 a.m. to 4 p.m., excluding holidays. Access HRA. Access HRA is a public-facing website designed for existing HRA clients and new applicants. Through the Access HRA websites, the clients can apply for cash assistance, emergency assistance, SNAP, HEAP, Fair Fares, NYC. They also can recertify for cash assistance and SNAP benefits. The clients can submit case change or closing requests. The client can submit in a SNAP periodic report. The client can request childcare as part of a cash assistance case, which is commonly known as civil. The clients can read notices from HRA. The clients can view payments and case details. The client can request a budget letter. A budget letter can take 7 business days and not including the weekends or holidays. So a budget letter is required or requested in advance. Upcoming renewal of medical for individuals who are 65 and over and who have disability. So Access HRA is a public-facing website designed for that client to have control of the benefits that they're receiving or want to receive and their need to apply. Access HRA mobile app. So after the client submits an application, the next step is they need to submit documentation based on the information that they enter in the application. Certain documentation needs to be uploaded or sent. So the client does not need to visit an HRA office. The client does not need to fax unless if they want to or visit. The client best and save time is by Access HRA mobile app. Is a public-facing mobile app designed for HRA clients. The public Access HRA mobile app, the client can upload documents, read notices from HRA, view case details, case status, EBT balance, and next payments. View case status, EBT balance, next payments, upcoming appointments, documents over and documents recently received. So in order for that client to have control of the benefits that they're receiving, Access HRA mobile app is the best way to have as part of the app on their phone. NYC HRA Document Upload is another app. It's a public-facing mobile app designed for clients and representatives like CBOs that assist clients with applications or assistance. And then there's no need to sign or create an account to begin uploading documents through this app. Easily very personal details using identifiers such as a case number, clientification such as their SIN number, Access HRA confirmation number after they submit that application. There are 3 easy steps to upload documents. Select your identification type, select and take a photo of the document and upload the document. The best way, and I highly recommend Access HRA to upload documents because it is time-stamped. It gets recorded when the clients submit the documents. NYC Child Support Access HRA mobile app makes it easier to access child support services. Through the Child Support mobile app, the client can submit a child support referral or enrollment, can make a payment for child support by credit card, debit card, or PayPal, maintain contact information, view upcoming appointments, enroll for child support debt reduction, and challenge an enrollment action. Cash assistance. Application or certification for cash assistance can be submitted online through Access HRA, and HRA will call clients to complete an eligibility interview. Required verifying documentation can also be submitted with a smartphone using Access HRA by taking a photo and uploading the documents. Application for emergency assistance commonly known as One Shot Deal, can also be submitted online through the Access HRA website, such as if in case the client is encountered with rental assistance, they're behind the rent, they could submit that One Shot Deal. Okay? If they have to prevent utility turn-off, they also could submit a One Shot Deal, okay, through the Access HRA website. Cash assistance. New Yorkers in need may qualify for temporary cash assistance and ongoing basis for one-time assistance to meet an emergency need. Eligibility for cash assistance depends on a variety of factors such as income, expenses, resources, household composition, and immigration status. Applications may be filed online through Access HRA. Those unable to file an electronic application can call 311 for more information on how to submit an in-person application. Key facts such as identified residence, immigration status, income, and resources must still be verified in the application process. HRA will call applicants for interviews. Families with children can receive up to 60 months of cash assistance for the Federal Temporary Assistance for Needy Families program. Child care assistance is available to help those who are working or must meet work requirements. Single parents households receiving TANFs are referred for child support services. Single adults and adult couples may qualify for state-funded benefits under the Safety Net Assistance Program. Families with children who are cash assistance longer than the 60-month federal time limit may receive additional state-funded benefits under the Safety Net non-cash assistance program. Employment services. Due to COVID-19 pandemic, HRA Career Services mandatory engagement activity has been suspended, but mandatory engagement will be starting soon. HRA Career Services program focus on improve and individualized assessment for its clients receiving cash assistance. Our services seek to address each client actual strength and needs to improve outcomes with focus on maximizing education, training, and employment-related services for job opportunities that create basis for building career pathways out of poverty. Okay. Supplement Nutrition Assistance Program. To apply for SNAP benefits online, they have to go to Access HRA. The certifications for SNAP require an eligibility interview. This interview required resume on June 1st, 2022, after being suspended due to COVID. Complete and submit the SNAP periodic report, SNAP change report, or request the SNAP case closing online. Upload pictures and require verifying documentation using the Access HRA mobile app. Eligibility interviews are required for all clients and recertification. Applicants and clients can complete this requirement by calling 718-SNAP now, Monday to Friday between 8:30 and 5 p.m. Please be aware if the client is applying for SNAP services or benefits after they submit that application, the client is responsible to call 718-SNAP now in order to complete the process of that application, of course, and make sure that the client is also submitting the supported documents based on the information that they enter in that application. More than 1.6 million New Yorkers receive SNAP benefits monthly, and most of these clients do not receive cash assistance. Monthly benefits depend on a variety of factors, including the household size, expenses, and income. To qualify for SNAP, an applicant must submit an application that allows HRA to identify the SNAP household, individuals, or group that lives and usually purchase and prepares meals together, regardless of the relationship to one another. SNAP households usually includes a spouse, children living with and under parental control of an adult, and biological adoptive parents of children under the age of 22. Elderly individuals who also have disability and their spouse may qualify for separate household status, even if they purchase and prepare meals in common with other household members. These individuals may become eligible for this status if they are unable to purchase and prepare meals separately. Applicants are required to call 718-762-7669 within 30 days of the file date to conduct the eligibility interview. Anyone can apply. To verify eligibility criteria, including residence, income, immigration status, and resources, the single issuance may be issued within 7 days of application for households that qualify under the expedite processing rule. Eligibility for ongoing benefit is determined pending verification of the criteria above. New York residents can apply for SNAP online via Access HRA. And once they submit the application, they need to conduct the phone interview. Okay. Medical insurance. Medical insurance for people who are 65 and over or who have disability is administered through HRA. Medicaid clients who have questions about their case need to replace their Medicaid card or want to report case changes such as change of address can call the HRA Medicare helpline at 1-888-692-6116. New Medicaid applicants for individuals who are 65 and over who have disability can submit at any of our community offices through the 5 boroughs or by faxing to 917-639-0732. During the COVID-19 public health emergency, PHE, Medicaid cases were automatically extended without client intervention. This ISME will end starting with renewals which have a June 30, 2023 expiration date. Cases with a June 30, 2023 expiration date are or later will now be required to submit a renewal to continue receiving Medicaid benefits. So very important, if you receive a package, be sure that they complete that package, the renewal package, okay? So don't let that case close. Office of City-Wide Health Insurance, OCHIA. New York State offers free and low-cost public health insurance plans to most New Yorkers, including Medicaid, Child Health Plus, and Essential Plan, as well as private coverage, and financial help through the office official health insurance marketplace known as the New York State of Health. New York City residents may be able to get public health insurance even if they own a house or a car, have a bank account, or receive private health insurance. Applicants must meet program eligibility requirements, including income, residence, and immigration status. All children are eligible for Child Health Plus, regardless of immigration status. Most New Yorkers can compare plans and apply through the New York State of Health. If you are 65 and over, have disability, you can apply for Medicaid through HRA. You can get information and assistance by calling HRA Medicare Helpline and get personal help by calling the 347-396-4705 to make an appointment. If you want to learn more about this, you could visit the website. Okay. Affordable Care Act. The Affordable Care Act aims to make health insurance accessible to more individuals by reducing the cost of insurance. New York City residents can sign up for the health insurance and financial help described below through the New York State of Health. Who is eligible? Medicaid, adults in family of 4 earning up to $38,295 a year. Okay. Child Health Plus, child in a family of 4 earning $111,000 a year. The Essential Plan, adults in a family of 4 earning up to $55,500 a year. Tax credit and cost sharing assistance, family of 4 earning up to $69,375 a year. Cost sharing assistance, financial help with out-of-pocket costs, such as co-pays, co-insurance, and deductibles. Tax credit to help paid for premiums. Family of 4 earning up to $111,000 a year. Premiums monthly payments to an insurance company for a package of medical benefits. Okay. The New York State of Health, the state official marketplace for getting health insurance. Who it serves? Mainly individuals under the age of 65. Businesses with 100 or fewer employees. Most people with employer and sponsor coverage are not eligible for tax credit. What it offers. One application for public or private health insurance, compare plans and enroll. Financial help to pay monthly premiums. This can be done by phone, online, or in person. The Office of Child Support Services. The Office of Child Support Services puts children first by helping both parents provide for economic and social well-being, health, and stability of the children. OCSS serves parents, regardless of income or immigration status, lifting tens of thousands of New York City children out of poverty every year. OCSS mission is to assist with locating non-custodial parents, establishing parentage and child support orders, collecting and distributing child support payments, modifying and enforcing child support orders, and assisting NCPS with debt management and employment. Custodial parents receiving cash assistance are required to comply with OCSS pursuant to federal and New York State statutes. All other custodial parents may apply for OCSS services on a voluntary basis. OCSS for assist families by drafting agreements to establish or modify child support orders prior to court hearings with aim to offering a more friendly approach and fewer court hearings. Easing access to child support services via New York City Access HRA Child Support mobile app. Enroll for child support services. Make child support payments by credit, debit, and PayPal. Apply for debt reduction programs. Submit enforcement changes. Obtain contact information and more. Referring families for mediation services. Enroll for child support services in person at borough office or family court locations using the Access HRA Child Support mobile app, downloading or completing and emailing the application to OCSS. Interviews for new applicants are done in person at any office via phone appointments. Get assistance in person at a customer service walk-in center at 151 West Broadway in Lower Manhattan and at OCSS family court offices in each borough. Additional ways to get assistance include email, phone appointments, contacting the New York State Child Support Helpline, and mail. To learn more about OCSS, please visit the websites below. Emergency assistance. New York City residents may apply online through Access HRA for one-time emergency grant, generally when an unforeseen circumstances prevent them from meeting expenses. To qualify, applicants must be income and resource eligible and meet the specific grant guidelines. Emergency grants can include rental assistance in case of impediment eviction or rent arrears have occurred, assistance with home energy and utility bills, new apartment expenses, disaster assistance, including replacements of clothing or personal belongings. New York City residents already in receipt of cash assistance can also request help with the emergency situation online using Access HRA by requesting a special grant. Clients can also request case change or request to close their cases using Access HRA online or the mobile app. HEAP provide grants to assist low-income families and individuals who pay separately to heat and or non-heat related utility services. Any person requesting a grant for a heat or heat-related emergencies is assessed for HEAP eligibility. This includes requests for payments and utility bill to restore electric services needed to operate a furnace, boiler, or when the house is without heating fuel or has a heating fuel supply that is equal to or less than 1/4 of the household fuel tank. HEAP also provides grants to income-eligible renters who do not pay for HEAP. HEAP benefits begin each November and are offered through the cold weather months. HEAP also has a component to help low-income New Yorkers during the summer by providing a cooling benefits. Lastly, HEAP has a component for homeowners who need help repairing or replacing their primary heating equipment. For more information, call 718-557-1399. Homeless prevention and services. The homeless prevention and services. Rental assistance. HRA provides a variety of rental assistance programs, including the provision of emergency rental assistance to prevent eviction for low-income families and individuals. The operating of family homeless eviction, known as FHAPS, programs for families with children of cash assistance who are facing eviction or in shelter, and the city FHAPS program that assists families and individuals in avoiding homelessness and residing in shelter and relocating to a permanent shelter. DHS provides temporary emergency shelter to homeless individuals and families with a rich continuing and social services such as counseling, case management, substance abuse, treatment, specialized services for veterans, and house permanency services to connect eligible households to rental assistance program, delivered directly in collaborating with other city agencies and community partners. Home Base. Home Base is a community-based organic program that connects New Yorkers at risk of eviction and shelter entry to a wide range of services under one roof, including eviction prevention services, assistance obtaining public benefits, education and job search assistance, financial counseling, money management, short-term financial assistance, assessment for and submission of application for rental assistance, and help moving to a new location. Homebase has locations throughout New York City, 5 boroughs. Homebase workers are enrolling clients remotely, virtually, and in person as needed. Learn more about Homebase, either call 311 or visit homebase-hra.nyc.gov. Free legal assistance to prevent eviction. DSS Office of Civil Justice partners with legal services organizations across New York City to provide legal assistance to New Yorkers facing eviction. OCJ legal services are free and available in every zip code, regardless of immigration status. You don't have to be existing HOA client to apply. OCJ legal providers are connected with residential tenants facing eviction in housing court at their initial court appearance to provide legal advice or representation. Tenants should go to the first court appearance and say, I would like an attorney when they appear in court. OCJ legal providers are available Monday to Friday from 9 a.m. to 5 p.m. to provide over the phone legal advice to callers with legal questions or issues about tenancy, eviction, landlord-tenant dispute. For more information, call 311 or call the tenant helpline via or email civiljustice@hra.nyc.gov. Fair fares. Using the Fair Fares NYC discount, participant in New York City residents receive a 50% discount on subway and eligible bus fares, as well as access and ride paratransit trips, pay per ride, the weekly or the monthly, unlimited optionals available. Fair Fares NYC applications are open to eligible New Yorkers ages between 18 to 64 at or below poverty level and who do not have discount transportation, MTA or city. You can check for eligibility by visiting nyc.gov/fairfares. You can upload required verifying documents with the Fair Fares NYC mobile app. Existing Fair Fares participants can call 311. Fair Fares, if they lose their MetroCard, is only replacement once a year. If they want to visit a location, they're open from 8:30 a.m. to 5 p.m. They just have to call 311 to find the location of the Fair Fares offices. Okay. Assist most vulnerable New Yorkers. IDNYC. You probably have seen this ID. Okay. IDNYC services at enrollment centers are available by appointment or walk-in. Appointments are strongly recommended as availability for walk-ins independent of the volume of clients at the site. You can visit IDNYC locations to apply for a new card, replacement card, or to update information on your card. There are enrollment centers across the city. Okay, IDNYC renewals can be complete online at nyc.gov/IDNYC. If you have no changes to your assistance soon to be expiring IDNYC, make sure that you renew that card. Okay? IDNYC is a free identification card for all New York City residents. As a government issued photo identification card, IDNYC allows access to services and programs offered by the city as well as businesses. IDNYC benefits every city resident, including the most vulnerable communities, homeless, youth, the elderly, undocumented immigrants, the formerly incarcerated, and others who may have difficulty obtaining other government-issued ID. It is accepted as proof of identity by NYC agencies when applying for city services, including marriage licensing, birth certificates, and benefits like SNAP, cash, and Section 8 by NYPD police officers are as valid identification for entering public buildings like schools and for taking the high school equivalence exam in New York State. It can be used in multiple ways as a library card across NYC library systems, use the Big Apple discount medication card, and so on. Okay, so for more information, visit www.nyc.gov/IDNYC. HIV/AIDS Services Administration, HASA, provides access to essential benefits and social services to individuals living with HIV and AIDS and members of their household. HASA is committed to service provision that is individualized, efficient, effective, and of high quality. HASA services are wide range and include specialized intake, needs assessment, and ongoing case management, linkage to and help applying for social services from public assistance to homemaking, emergency housing services, and permanent supportive housing placements, voluntary vocation counseling, rehabilitation, and job placement, For those seeking more information about hospice services, please call 718-557-1399. Home care or long-term care services. The Home Care Services Program, HCSP, provides access to or authorizes services for a variety of Medicaid-funded long-term care programs designed to help people who are elderly or have disability remain safely at home rather than in a nursing home or other institutions. Home care services include services such as personal care, managed long-term care program, assisted living program. Eligibility for this program vary based on medical needs, household income, and other circumstances. Consumers seeking community-based long-term care assistance should consult New York City Medicaid Choice. For more information and assistance in choosing a plan, the client can call NYCMC MLTC by calling 1-888-401-6582. Adult Protective Service. APS helps adults in danger of abuse, neglect, or exploitation. If you or someone in need of help, refer them to APS by calling 718-557-1399. APS is a case management program that arranges from services and support for physical and or mentally impaired adults who are at risk of harm. APS seeks to promptly resolve the risk faced by eligible clients with services plans that will enable them to live independently and safely within their homes and communities. APS is available to persons 18 years old and older without regard of their income. Okay. Domestic violence services. HRA provides a broad array of services for those seeking local community support, and as well as housing alternatives when confronted with domestic violence, such as housing and shelter assistance, benefit assistance of social workers, HRA benefit centers to address safety concerns of cash assistance clients who may be in danger, community resource, community-based DV services, including counseling, educative groups, advocacy, financial counseling, and information, teen relationship abuse prevention program, Teen RAP, a school-based domestic violence prevention program in 71 New York City schools from the 12 middle schools and 59 high schools. Okay. For more information, okay, they can call 1-800-621-4673. Okay. Community Food Connection, CFC, provides funding to almost 700 soup kitchens and food pantries across the 5 boroughs. New York City has committed more than city dollars to these programs than any other large city in the country. CFC staff coordinate the distribution of non-perishable and frozen food commodities as well as fresh products to members programs and monitor the emergency feeding programs to ensure adherence to the CFS and agency guidelines. For more information about community food locations and hours of operation, call 311 or visit foodhelp.nyc.gov. Burial assistance. Burial assistance. HOA Office of Burial Services helps individuals in need of financial assistance to meet funeral expenses for deceased low-income New York City residents. The program can reimburse funeral expenses that have already been paid or make pre-approved payments for the cost of the planned funeral. OBS cannot pay up to a maximum of $1,700 towards the cost of funeral bill. Total burial cost cannot exceed a cap of $3,400. To determine eligibility, an application must be submitted and OBS will assess the individual circumstances for each case. Applications can be submitted by mail, fax at 917-639-0476, email at burialservices@hra.nyc.gov, or in person. The OBS office is open to the public Monday to Friday between 9 a.m. to 5. The office location is 33-28 Norton Boulevard, 3rd floor, Long Island City, New York, 11101. How to reach HRA for general programs information. As you can know and probably seen throughout this presentation, keep mentioning the following number, 718-557-1399. If you call this number, okay, there's many offices that it is connected to. Just make sure that you listen to the prompts in which department you're trying to connect. Okay? Cell services available 24/7 and infoline agents are available. Monday, Tuesday, Thursday, Friday from 8 a.m. to 5 p.m. Wednesdays, 8 a.m. to 7 p.m. Or you can visit HRH www.nyc.gov/HRAs and go to contact us and send a message to the commissioner. Thank you. And this is the DSS overview of the services that our agency helped many New Yorkers. So there are a lot of information that was given today that hopefully you took some screenshots, but you have the representative from CBA where you can ask questions if you need further assistance. Do not struggle by yourself. If in case you need guidance for the services that you're trying to apply, you already have somebody where you can connect and ask questions. But thank you so much for allowing the Department of Social Services, HRA, to be part of this meeting tonight, and for you taking the time to be part of this meeting too. Thank you, and I think that's it. Okay.
Thank you. Question. I noticed you said to apply online, but what if people don't want, if they don't have access to a computer, they can also come into the office and apply, right? Yes.
So yeah, so if a client wants to have issues to apply, and we do understand because we have seniors, we have people with disability, so there are CBOs within the communities. Like for example, yeah, they have some organizations. I don't want to say specific names, but let's say I believe
home base, like home base.
Yeah, home base. Yeah, home base will be one of kind of like the direct place. Or if in case your CBO have like a social services person appointed or someone in like the constituency assistance, and probably you need some guidance, and probably you could connect them to other organizations that are within that community. Or also, like I said, if in case there is a need for applications to be sent, or a request, that also could be some type of accommodation, like reasonable accommodation, because we do understand that not everyone it's computer savvy when it comes to the new era that we are moving forward, which is everything is very digital. So yeah, but that one thing will be home base or the reasonable accommodation if in case they're having issues to submit this document or apply for this benefit.
All right, thank you so much. Now, does anyone have any questions about this presentation? Bastian, David, Kimberly?
No questions. I felt like Ms. Maritza explained herself very well.
All right.
There was a lot of information, too much information. I tried to skip some stuff, but.
Yes, not a question, actually. It was very good. Quite a lot of information that's hard to track. If you could, Omar, you may want to get a copy of it and share it with all the board members and ask the office to post it on our webpage.
Could you send that entire presentation to Sebastian? No?
I think we're not able to share because sometimes we made updates in the slide. From my understanding, this presentation will be recorded and then it's going to be available for the constituents later on. And I think some type of platform, social media, if I'm not so sure, where the potential clients who need to apply or need to refresh or understand each of the slides that was presented, that's one way from there that they could like refer them back. But we're not able to share the slide because we do updates accordingly. And if in case that is kept, things can be not giving the right information.
Well, then maybe you want to just simply send that which you would like us to post on our webpage for the community board.
Okay, I could definitely follow up with that request.
Okay.
Thank you so much.
Do you have a specific thing that you would like? Well, we could discuss that later with Omar.
The key points, just the key points.
Got it.
All right, so thank you so much. It was a good presentation, and I have your email, so I'll be reaching out to you for more information. All right. So thank you so much for coming tonight and for the job you're doing in this post-COVID era.
Not a problem. Thank you.
Thank you. Thank you. Next up is NASNA, New York State Nurses Association. Julia, good evening and welcome. And Judy, good evening and welcome. a lot's been going on. You
Yes.
know, so tonight I wanted to know, for the community to know what has been going on. You know, as you know, we really value you guys as the frontline workers. You know, my wife is a nurse. She's a member of NASNA also, so I understand.
Oh, cool.
So with that said, I'm going to turn the floor over to you, Julia.
Yes, thank you. Thank you, Omar, and good evening, everyone. My name is Julia Kamagong from the New York State Nurses Association in the Political and Community Organizing Department. And first, I want to thank everyone. I want to thank Community Board 8 in the Bronx for giving us the opportunity to share with you what happened, you know, in the beginning of the year when the nurses at Montefiore Medical Center went on strike for 3 days from January 9 to 11. And this was a result of several issues that have been existent for many years. And we were trying to negotiate with the hospital, but unfortunately it had to go to this point that the nurses went out on strike. And actually we have a couple of nurses with us tonight. We have Judy Sheridan Gonzalez. She is the former president of our union, New York State Nurses Association. She works at Montefiore Medical Center in the ER, has been a nurse for more than 30 years, maybe more than 40 years, and also a lifelong Bronx resident. So she will be sharing, you know, the bigger context of the strike and the issues. And we also have Shirin Sayem, who is with the Medical Surgical Unit over at also Montefiore Medical Center. So I'll give the floor over to Judy, and thank you so much again for having us.
Sure, I think I'm unmuted, right?
Yes.
Yeah, I want to thank you again. I actually live in CB8 over on, I live in Amalgamated Houses in CB8.
Okay.
I lived there for many years. I used to live further south, but got in here and, you know, work at Montefiore at Moses Division. So I work in the ER and Sharon works on the medical floor. So we can give you a little perspective about what it's like to be a patient in the ER, what it's like to be admitted. And that was the basis for a lot of our difficulties. For those of you who've lived in the Bronx, in this region for a while, you know that the conditions in the hospital have deteriorated greatly over the years. Our staffing is much worse, training is much worse. The patients are waiting much longer for admissions, they're waiting longer for appointments. And because of the conditions, many of the people with insurance have gone elsewhere for their care, which has the hospital complains that it has a huge Medicaid, Medicare population, but in many ways, the inability to provide appropriate services has turned a lot of patients away. We went through a terrible time during COVID. We weren't given the appropriate protections. And because that was an emergency, the hospital was very abusive in violating our contractual rights, for example, forcing us to work up to 24 hours straight, which is actually against a law that was passed, not responding to many of our needs. And we lost many, many nurses, and they have a very poor track record in recruiting and retaining nurses as well. We found out under oath, they were under oath, that they had 3,000 nurses wanting to work there that they never hired. We had an arbitration where they had to testify. So many of the systems there are very inefficient, both for the staff that works there and for the patients. We started negotiating in September. I was on the negotiating team. We had almost 40 sessions, and we made about 1% of the progress for the first 4 months. It was only when we put out our 10-day notice to go on strike that they started to actually negotiate. And 90% of what they negotiated prior to the strike was in the last 8 hours before the deadline, from 8 p.m. to 4 a.m. So clearly they were not taking us seriously until they had to face the reality that we would actually go on strike. The decision to go on strike was a very difficult decision, but we felt we had reached out to the community in a variety of forums to let them know this was a possibility, that they could receive care. We have a campus over at Einstein as well. You know, we assured people they could go to Jacobi over there, go to NCB over here, to please use those services if they had emergencies, and to put off any procedures in case we did go out. Obviously, it was very successful because when we did go out on strike, the hospital was pretty much brought to its knees and just during the 3 days negotiated the rest of the contract. We got them to agree to, to agree to look into expanding the emergency department where patients are packed like sardines, waiting hours and days for beds, with a terrible situation with patients with mental illness being completely next to patients with cardiac problems, waiting hours and hours to be seen, improving the wait times in the clinics, opening more clinics, opening up more beds, developing a system of enforcement of the contract so it couldn't be violated, multiple plans to recruit from the community, to encourage and support students, nursing students, so that we could recruit nurses, and making changes in a variety of scales, benefit and salary scales, so that nurses would stay. Because what was happening was most of the young nurses were leaving and working for these travel agencies where they made 5 times as much money, and we had to compete with them because the hospital was paying for these travelers, which didn't make any sense. But I'll leave it to Sharon to talk about what it's like to take care of a patient in a hallway, because what Montefiore did was it abused Department of Health provision that allowed hospitals, when the ERs were overcrowded, to temporarily place patients on stretchers in hallways, on the units upstairs. No bed, no toilet, nothing. And instead of doing it once or twice during an emergency, we have hundreds of patients in the medical center at times who are in hallways. So Sharon, do you want to talk about what it's like to take care of a patient in your unit, and what drove so many of our nurses to feel that they had no choice but to go out on strike?
Hello, everyone. Good evening. Yes, the patient ratio and the patient care environment and situation was one of the actually most important reason for all of us to go on strike. It was not human. We would have 80-year-old, 90-year-old patient coming and staying on the stretcher hallway with no access to bathroom. There is light 24 hours right over your head. You cannot sleep. We did not have enough ancillary staff to help the nurses to do what they want to do, or vice versa, both ways. They were short, we are short too. And I could say it went on same for the physician assistant, for the doctors. We all are overworked. None of us had our ratios. So overall, the working situation and the condition was not healthy for any of us. Not for the patients, not for the nurses, not for anybody. So that was the reason that driven us to go on strike. What we were actually asking for better patient care. We wanted to fight for our community. For the patient that come to the hospital, we wanted to provide the services that we as human beings would like or deserve when we go to a hospital. And I would really like to mention, we do see some changes are being made. Before, we used to have 4 hallway patients. Now we have 1. One of the unit that was closed for apparently no reason, that is half open. So I believe the hallway patients are being sent to class 6 instead of making them a permanent home in the hallways. There are some motion going on for hiring. We do see that now. There is a lot to fight still, but I believe we are progressing and we are making some development and we are making some progress.
So where are you presently right now? Are you negotiating a new contract, or?
No, when we go on strike, your criteria is that you'll come back into the hospital when you finish your negotiations, when you reach an agreement. And the pressure of the strike is what pressured the hospital to agree to things they could have agreed to months earlier. So in 3 days, we definitely had a contract. The committee negotiates the contract, and then they present it to the members, and the members in our hospital have a week to read and understand and then vote. And we had like a 98% yes vote,
Mhm.
and over 80% of the nurses came in person to vote. So they were overwhelmingly pleased with the contract.
So
And
that
so now,
contract,
yeah,
so that contract lasts for how many years now?
3 years. We have a 3-year contract.
3-year contract.
And then hospital has to enforce it. So what we felt we needed to have was an enforcement mechanism in the contract.
Mhm.
And ironically, what happens is when you go to the way the grievance process works is you file a grievance, the hospital doesn't agree, you can go to an arbitrator. The
Right.
arbitrator cannot rule penalties unless you have some prescribed penalties. So this time we were successful in getting penalties, financial penalties for the hospital for violating the staffing and the other provisions that would provide for safe care.
Okay.
Because we had documented what we do is every time we have an unsafe situation, we fill out a form called a protest of assignment. We had thousands of them, meaning that nurses every day felt patients were in danger. So we want that to stop. And one of the ways to enforce that is if the hospital is found to violate those provisions, there's a penalty. They have 2 choices. And one of the choices, this is sort of funny, but they did agree to it. One of the choices is on a unit where, let's say the patients are compromised, they have to give the patients on that unit for that day a 15% discount in their care, in their services. That's one of the penalties. So, you know, we thought we were very creative, really to discourage them from violations. But it's not over. We're still struggling to get funding for something called the Nurse Family Partnership, which is a life-saving measure that is grant funded to save the lives. We have the highest infant and maternal mortality rates in the Bronx. In fact, we have the worst health statistics in the Bronx of the entire state on every level. We have the highest population of people of color, and many immigrants, and people are treated badly. You know, there's call it like medical apartheid. So, you know, we really want to impact those statistics by providing, you know, this is the largest employer in the Bronx, a major medical center. The care in the Bronx is not like the care in White Plains Hospital, where the population is different. And we feel that Montefiore should treat all of its patients the same. We have a slogan in NISNA that every patient is a VIP. And we feel that every patient should be treated that way, like a very special person.
Right. That's so true. Are there any questions for Nasna? Perhaps, you know, it's hard to hear what's going on, considering how you guys put your lives online, and yet they don't want to give you what you need in order to complete your job. It's crazy, and you know, I mean, the hospitals got a lot of money during COVID. So I mean, where did those money go?
Monty got 1.8 billion. But they spend a lot of it on PR and, you know, token kind of things, billboards and advertisements during the Yankee game and things like this. It's word of mouth is what gets patients to a hospital, not advertising.
Right.
I mean, people may try the hospital, but once they hear about conditions, they go elsewhere. It's foolish. They waste their money. But maybe people have questions about. I mean, we would love for the community to continue to apply pressure on Montefiore to do a better job. We found that very helpful with the community support. We had a lot of community support. We were partnered with our community because what we were fighting for was the community, and they were fighting for us to be able to take care of them. It was a nice alliance, actually.
Right. Any questions? David, Kimberly, Sebastian?
Omar, just want to say thank you to all these wonderful nurses for what they do every day.
Yes.
During COVID, before COVID, after COVID. Great job.
Thank you. Thank you so much. You know, you had nurses who actually lost their jobs, who actually lost their lives, you know, so.
Yeah, we had 80% of the ER got COVID at Montefiore. We were not given the proper PPE in the beginning. We all got, so many of us got sick, and we did lose staff.
Wow. Well, Julia and Julia, I encourage you to stay in contact with the board office, and I have your emails, and whatever you need us to do, you know, we'll speak to the chair and the board office, and we'll do our best to support you. Okay.
Thank you, Omar. I just wanted
you know,
go ahead.
Let me just add, you know, maybe we could think of what we'd like is more pressure on them to open up empty areas. There's a an area that they're doing COVID testing right now, which could hold 40 patients comfortably with dignity. Maybe we'll come to you with a particular letter we'd like the community boards to send to please open up these areas so our patients aren't sitting in the ER and aren't in hallways on the floors.
Right.
To get the nurse family partnership back running so that our moms don't die and our babies don't die unnecessarily. We've had several maternal and child deaths that could have been avoided, which is horrible. And to do something about the mental health issues. We have sometimes 20 or 30 patients who are psychotic, just sitting. Even children. We had a child, an autistic child, who was 6 months in the ER in a room like a prison cell. We'd love for the community to we think that that's going to help pressure.
Right.
So we'll call on you to help us.
Yes,
We will.
you have our email address, so just send us and let us know the letter, the structural letter, and how you want it, and who should it go to.
Great. Thank you
Alright.
so much. We really
Thank you so
appreciate you
much.
inviting us here.
Yes, I appreciate you
Yeah,
coming as well. And
Yeah, I
thank you
just
for the
wanted
job
to
you're doing.
add, yeah, thanks, Omar. I just wanted to add that, like what Sharon was saying, that the fight is not over. Right now, we're in our next campaign where North Central Bronx, which is the neighbor of Montefiore Moses, we have Lincoln Hospital in the South Bronx. We have Jacobi Hospital, which it's not in CB8, right? But
Yeah.
these are the New York City public hospitals that are now in the middle of a campaign fighting for the same things that the Montefiore nurses were fighting for: safe staffing and safe patient care. So we are in the middle of that, and I'm sure that the nurses from these hospitals would love to also have this conversation with you at your next meeting, or whenever we can have a chance to attend.
You're welcome to attend anytime. And of course, if you log on to the community board website, you can become part of you get a newsletter and a listing of all the meeting dates. All right.
Great. Thank you. Thank you very much.
Thank you so much. And thank you for coming.
Okay.
Thank you.
Thanks again. Bye.
So next up, budget, David, budget. Okay. I don't have much people here, Kimberly and Sebastian. So let me do share screen. Share.
Omar, if I may,
Yes.
while you're setting that up, it's great that we got the frontline people who serve our community to speak. You may want to contact Montefiore to see if they have any comments, because they are the service provider, and they may have some comments on that. And we don't take any sides in this, so we should.
Right. I'm just saying. I'm gonna contact them and see what they have to say about what.
Very good. You might want to send them the link to the this YouTube on our website, and they can look at it. And their government affairs people or whatever may want to speak at a future health and hospitals meeting.
Right. Yeah. I have a good relationship with the government affairs official there, so I'm gonna reach out. I'm gonna reach out to her.
Excellent.
So this is a listing of our previous budget requests.
Right.
I wanted the committee to go over it, make suggestions, and then at next meeting we could go over it, because there's a lot. Steve is absent, and I guess one new member is absent, so I'm barely even making quorum tonight.
Okay.
So, can you guys take a look at this and tell me what do you think? I know that protective gears, I don't think that's needed anymore, right? No.
I think it probably not as prominent as last year when we had it on the list.
Some of these stuff like the COVID test kits and all that, I think we have to, like, counseling services could stay. Protective gears, that is gonna be removed. And what is this? Mayor's Office for Advisory Board. I think we got to, a lot of these things have to be removed. And do you want me to email you guys? Do you want me to email the committee this and then you guys send me your suggestions? And then we bring it up next meeting?
Sure, that works.
That works better, right, David?
Yeah, that's fine. It just, two things. One, next month, you need to go through all this and decide what priority order your expense ones are. And I don't know if you have any capital requests as well. And the other part is, you know, either now or in the coming weeks, I mean, you really should have it set up now, but to encourage your committee members to come up with new ideas if they have anything. You know, maybe there's something that they really wanted to talk about that they think should be on the list. Don't just rely on the prior year's list.
Just one question. This budget is for the city budget, right? Doesn't
Community
affect
Board
this.
8, yes. Community Board 8.
As
This is
opposed
kind of-
to what, Sebastian?
This is kind of our wish list, right? To the.
Yes.
I'm
to
sorry,
the
what?
city.
It's
No,
a
this
wish
is
list to the city. No, he's saying if it's like a wish list to the city. Well, yes, it's kind of, because they do what they want to do, even if we do send it in, right, David?
Well, the agencies have their budgets, but these are requests to be made to the agencies to make sure that they focus on certain things that are of concern to the residents. And you committee members are representing the residents, but of concern to the residents of the CBA district. Now, for
Yeah.
example, you know, there was mention of the domestic violence unit that was raised because there was concern that there was, you know, a need for a DV unit at the 5-0. I think that's a very valid thing. I mean, these are all valid, but you know, if you have ideas of other things, you know, you folks are saying, well, maybe we don't need quite as many, you know, masks and gloves anymore. Okay. But maybe there's something else that's new. Health or social services at the schools, at some of the local agencies, other programs. I'm not trying to speak for you. I'm just trying to, you know, stimulate some thought. But these are funds that would funding that would come from the various agencies like Department of Health, Mental Health, DSS, Community Affairs, and yes, again, the NYPD, the Domestic Violence Unit. So,
Yeah.
I mean, was there something else you were thinking of, Sebastian?
Yeah, no, David, thank you. I just wanted to, the reason why I asked is like for the state budget, from what I'm hearing is that there is a huge chunk of money set aside for mental health in the proposed budget. So that has no influence, like our suggestions or the budget list to the does not have any influence on the state budget, right? So should we check that if the money set aside on the state budget, should we put that in our proposal this year or not?
Well, state budgeted monies won't be part of this because we're not asking the state. However, if you are aware through your various contacts that, you know, the New York State Department of Health is allotting $500 million for local such and such programs, you could ask that the local such and such request an XYZ program to be funded out of those new revenues that are intended for, you know, adolescent behavior, whatever. I'm pulling terms out of the air, but I think you know what I mean. I mean, you can't ask here for the New York State Department of Health to fund anything here. But if you are aware that some of their funding, their new funding or proposed funding may come to a DOH, MH, or HRA, then that might be an avenue you can pursue. It's an interesting idea.
Okay, thank you.
Thank you. So what I'm gonna do is email you guys this list right here, and I'm gonna request for new ideas to put in for next meeting, and we go over it and discuss it as a committee. And David, of course, I'm gonna CC you on it and let you see what is being said. All right.
Yes, and again, I encourage you folks to look at this very closely, come up with your ideas, try to get them back to Omar, say a week before the next meeting, so that at the next meeting, you can vote on the priorities.
Sure. Thank you.
And Omar, there were no capital requests?
No, we never had any capital requests. It's always expense, but maybe this time there will be capital requests.
Okay, all right, very good.
All right. So yes, so everyone, thank you so much, Kimberly. Thank you so much. So Kimberly, I have your email, so I'm gonna send you as well, and you take a look and tell me what you think. All right.
Sounds good.
All right. So thank you guys so much for coming out tonight. I appreciate it very much, and we will be in contact. Okay.
Thank you. Have a good
All
night.
right. Thank you.
Thank
Have a
you.
good night. Good
Bye-bye.
night. Bye-bye.